Kenya today joined the world in commemorating the World Hepatitis Day, with celebrations being held at the Kenyatta Hospital in Nairobi. The World Health Organization says Kenya's prevalence of hepatitis B is 1.7% and 1% for hepatitis C.
3 counties were identified to have a high prevalence of hepatitis B, above 10%. Turkana, 16.8%, Baringo at 11.9%, and Migori, 10%.
Hepatitis C, however, is endemic among persons who inject drugs, raising the figures up to 15.6%, particularly in Mombasa and Nairobi counties.
Nilianza kwa kuvuta, kwa kupitia kwenye sigara, kisha nikagraduate, nikaanza kwa kujidunga. Hapo kwa kujidunga ndio tulikuwa tunashare shindano. Nikaja nikapimwa, nikapatikana kuwa nimeathiriwa na hepatitis C. Treatment nilipata kwa muda wa miezi 3, ambayo nilikuwa nakunywa dawa kwa kila siku. Baada ya kupimwa tena nikasemekana kuwa virally suppressed.
Even with government interventions such as vaccination, rehabilitation and treatment programs, there lies a risk of efforts being reversed in the near future. For instance, up to 90% of babies born to hepatitis B mothers will acquire the infection themselves.
Hepatitis A is largely seen in children, and in the majority of children it is asymptomatic. In up to 70% of children there are no symptoms.
Only about 6% of babies have received the hepatitis B birth dose vaccine.
Health experts have decried the huge expenses that befall health facilities in testing for hepatitis.
As it stands right now, it is actually more expensive to test you for hepatitis fully than to treat you.
With prices being as low as $60 per patient for a 12-week course of hepatitis C treatment.
In bettering outcomes, Kenyans have been asked to play their part and get tested prior to symptomatic stages.
Unfortunately, late presentations also leave us with limited treatment options. So when patients present with advanced cirrhosis, some of them actually can also present with cancer, and this leaves us with limited treatment options for these patients.
Ben Kerera, K24, Nairobi.